Good morning, everyone. My topic is clinical outcome of monofocal plus IOL with enhanced intermediate function with non-diffractive novel EDOF IOL. The purpose is to compare clinical outcomes of a new monofocal plus IOL ICBU with enhanced intermediate function with non-diffractive new EDOF IOL DFT215. The DF215 has two smooth surface transition elements, elevation and curvature changes that uses X-wave technology, and it stretches the wavefront. The ICBU has a modified aspheric anterior surface of the optic. 90 days outcome measures were binocular, uncorrected and corrected distance, intermediate and near visual outcomes, contrast sensitivity, binocular defocus curve, spectacle independence, photic phenomenon, dysphotopsia profile. The method was prospective non-randomized comparative study, single surgeon, tertiary care eye hospital. Data was analyzed with SPSS software version 20, group 1, 20 and 20 patients, 40 eyes, new monofocal EDOF IOL ICBU, group 2, 20 patients, 40 eyes, non-diffractive EDOF IOL DF215. These are the inclusion and exclusion criteria. The analysis of preoperative patient data of two groups for number of eyes, age, gender, axial length, pre-op myopic sphere, pre-op hyperopic sphere and pre-op cylinder were comparable. The distance visual acuity shows better uncorrected distance visual acuity and best corrected distance visual acuity in group 1 ICBU. Difference is non-significant. Intermediate visual acuity shows significantly better uncorrected and distance corrected intermediate visual acuity at 66 cm in group 2 DF215 p.00, and again intermediate visual acuity at 50 cm shows significantly better uncorrected intermediate visual acuity and distance corrected intermediate visual acuity in group 2 DF215. The near visual acuity shows significantly better uncorrected as well as distance corrected near visual acuity at 40 cm in group 2 DF215 p.00. So binocular corrected and uncorrected distance visual acuity shows comparable result. Uncorrected and distance corrected intermediate visual acuity at 66 cm and at 50 cm both is significantly better in group 2 DF215. Binocular uncorrected and distance corrected binocular near visual acuity shows significantly better result in group 2, that is DF215. Modular transfer function for contrast sensitivity shows comparable results between the two groups in photopic and mesopic condition. The statistical analysis for binocular defocus curve group shows group 2 DF215 IOL has significantly better result at versions of 1.5, 2 and 2.5. This is the graph, and you can see the group 2 has significantly better vision at 1.5, 2 and 2.5. Post-operative reading speed at 66 cm. The proportion of patients having post-operative reading speed at intermediate distance were significantly better in group 2, p.008, 95% confidence interval, 10% and 61%. The proportion of patients not at all bothered by starburst, halos and glare were comparable between group 1 and group 2. At 3 months, Qubit questionnaires were applied for this, and the proportion of patients having a spectacle independence at intermediate and near distance 66 and 40 cm was significantly more in group 2 DF215 in bright light condition, and the proportion of patients having a spectacle independence at this intermediate and near distance 66 and 40 cm was also significantly better in group 2 in dim light. So the group 2 did well in bright and dim light, intermediate and near vision distance also. IOL-SAT questionnaires were applied. So what this study adds, the bright light and dim light at an intermediate visual acuity at 66 cm and 50 cm is significantly better in group 2 accuracy of IQ VVT IOL DF215 than group 1 IHANS ICBU, thus facilitating intermediate tasks significantly like computer work, reading labels in the shop, cards, board games, crafts, playing music in bright and dim light, and photic phenomenon were comparable. These are the references. Thank you, and I have no financial interest.
Thanks, ma'am, for the beautiful presentation. All aspects, including the statistical analysis, the group differences and everything. Only one question I would like to ask you, ma'am. On what basis this principle is there between the trifocal and the novel IOL? Trifocal is dividing light, I suppose, is 50,
trifocal
30,
divides
50, 30, 20 or something
yeah,
like
it
that?
divides, and this IOL stretches the focus, because in the center this is not the study of trifocal and VVT. This is the study between VVT and the ICBU. But trifocal divides the light, splits the light, and here it does not split the light, it stretches the wavefront focus, because in the center there is an elevation, and elevation, and there is a curvature change. The elevation, elevation and curvature change, what it does, that the central light speed is relatively slower and peripheral light speed is same. So the wave front focus is stretched, so you get a depth of focus.
That was excellent, ma'am. Thanks, ma'am.